about the exercises that you want to do before your ACL surgery. So this is after you have had the ACL injury, it's confirmed via an MRI, and you have swelling, you have knee pain, and you really just don't know what to do. So prehab is super important, especially if you are going to have surgery, you want to get back to being an athlete. Getting stronger and reducing the swelling and normalizing your walking is very important before surgery. So we're going to go through some exercises that you can do literally the few days after you tore your ACL leading up to your ACL surgery, which is normally about 3 to 4 weeks after the injury. The reason why most surgeons are going to postpone this until about 3 to 4 weeks later is because they want you to reduce the swelling, improve your knee range of motion, and normalize your gait mechanics, which is your walking. So it's important that you follow along and you do these exercises. You're going to have your visits with the surgeon to understand what happened and confirm the injury with an MRI, but then you're also going to have to talk about graft choice and which one you're going to go with, especially if you're an athlete. Your surgeon may prefer one graft over the other. For you specifically, we have another video about that, so go ahead and keep following us, and you can get a little bit more information about the different options for graft types in another video. So again, this is week 1 of prehab. We're going to go through some of these exercises. I obviously am not recently injured, but I will show you how you can move through these exercises on your own. So a few things that you need that would be helpful for you to do these exercises. You'll need a strap. This is a yoga strap. You can also use a robe tie. You can use a dog leash. Some people use a long beach towel. Really, you just need something that's going to wrap around your foot. A towel, a green TheraBand, and then a chair, all right? So this is week 1 after you have torn your ACL. So first things first, we're going to lay on our backs and realize that you probably Okay, so I am going to lay on my back here, and I want you to do all of your exercises laying down. I, for the purpose of this video, am going to stay upright. This is my non-surgical leg, so that's bent, but I'm going to show you what you're going to do now with your injured leg. First, we're going to do what is called heel slides, and we're just going to try to bend that knee up towards our butt as much as possible, and then slide it back out. Now for this, I can already tell my shoe is giving me a little bit of a problem, so I'm going to take that shoe off. It's nice to be on a nice slidey surface, your bed or the ground, so you're on carpet or hardwood. So we're just going to slide that leg up and slide it back down. You're going to do this 10 times, and then you'll take a break. You're trying to get a little bit more range of motion with each bend. You're also trying to use that hamstring, which is the muscle on the back of your thigh, to help you improve that range of motion. This might be painful, and you might have a lot of swelling in the knee, making this really difficult, but you want to do this range of motion because it's going to help improve your swelling and improve your range of motion. More mobility before surgery is very good. Good, so this is kind of like a little bit of a warm-up. Now, after you've done 10 there, we're going to take this strap. We're going to put it around our foot. Now, I would recommend that you prop yourself up like this. You're going to use one hand, or you can use 2. But the first thing that you're going to do is a regular heel slide, and then to get a little bit more range of motion, you are going to pull up on this strap, and then you're going to slide it out and relax. We're gonna do 10 of these. So slide with your hamstring first, and then pull a little bit more. This feels like it might be centimeters or inches. That's okay. You're loosening up this knee. All right, again, if that's too much, go ahead and lay down, do your hamstring curl, and then use the strap to pull up. Go ahead and do 10. Good. This might be a great time to just pause so that you can finish up your 10. I'm going to move on to the next exercise so that we can keep going. We're going to do what's called prone knee flexion, which is, again, helping this knee bend as much as possible. I'm going to keep this strap wrapped around my foot like it is, and then I'm going to go on my stomach. So again, maybe my knee doesn't move that well, that's okay, and I will get on my stomach, and I'm going to keep this strap over my shoulder. Now, I'm going to try to bend my knee as much as possible, and then I'm going to pull it a little bit more with the strap. Hold for 2 seconds, and then relax. First, I'm curling with my hamstring, the back part of my thigh, and then I'm using the strap to pull a little bit more. Hold for 2 seconds, and then relax. Again, curl and pull. Hold for 2 seconds, and then relax. Curl, pull, hold for 2 seconds, and then relax. Good. You keep going. I want you to do 10 reps of these, holding each of them for 2 seconds. While you do that, I'm going to get ready for the next exercise. I'm going to talk you through what we have to use to get set up. We're going to use a green TheraBand. You can attach it to anything. I like to put it in like a door jamb or put it around your table. Maybe ask a family member to hold it for you. I've put it around a kettlebell here, and I'm not really sure how well it's going to hold, but we'll see, for this purpose. Now, we're going to get up and we're going to sit in the chair. Now, first, all we're going to do is just try to slide that heel underneath our leg or underneath the chair. And then you can either slide it back out on its own or use the other leg to slide it back out. And then we're going to curl, and then we're going to slide it back out. The more I make my muscles move, the better this knee is going to improve. That was a rhyme, and I didn't even know it. All right, so we're going to keep going with these hamstring curls. Again, that's the back of the muscle, back of the thigh muscle. Again, finish 10 and then take a break. And just to give you a little bit of information, once my ankle is underneath my knee, that's 90 degrees, okay? Any further gets into 100, 120 degrees. Normal range of motion for a knee joint is about 130 to 140 degrees. So we're aiming to get that, especially before surgery. Once you're done there, you can decide if you're ready to progress and add a little resistance. You might not get to this the first week, but the second week you will be able to add resistance. You want this strap or the band to be pulling your leg a little forward. And then all I'm going to do is curl my heel under my butt, hold for 2 seconds, and then relax. I'm not getting too much motion here, but I am activating my hamstring. This is going to help me progress with more of my range of motion as well as waking up those muscles to help support the knee joint. Again, we're gonna do 10 of these, and we're gonna hold for 2 seconds each. Squeeze and hold, feel that hamstring working, and then relax. With each of these exercises, you should be able to feel the improved mobility in your knee, maybe less achiness, less stiffness, because more motion actually is good for the knee. It mobilizes the swelling out of the knee, and then your body excretes it. So I know it may feel weird to be doing this day 1 or day 2 after you got injured, but the sooner you move, the better you are going to do pre-op and post-op. I know this injury is really scary, and you probably have so many questions. Why this happened to you? What is an ACL? How did it happen? Was I strong enough? It doesn't, at this point, the injury happened, and so now we are here to help you get through this injury and provide you with the best information possible and the best exercises that we find help our patients in the clinic. Good. So you've done 10 of the hamstring curls. Now what we're gonna go and do is work on our knee extension, okay? That is activating our quadricep muscle. So we're gonna come back down to the ground here. We are going to use a towel, and we're going to fold it up, and then we're going to roll it up. Now we're gonna put it right behind our knee. And this is the only time you can put a towel or anything underneath your knee. You don't want to prop your knee up like this pre or post surgery, because you can get what's called a contracture, and that's gonna make rehab a lot harder for you. So this is the only time you can put something behind your knee. Now what we're gonna do is we are gonna ask your quadricep muscle to contract. This is very difficult, especially after the injury as well as after the surgery. So it's important that you think about the cues I'm going to give you, because these cues are what help you contract that muscle, even though the muscle's really difficult to receive the neurological signal from the brain. Because of the injury, everything has kind of been cut off. So what we're gonna do, first, you wanna try to squeeze that quad, this front of your thigh muscle. When you're doing that, try to push your knee down into the towel. So squash the towel, pull your toes up towards your nose, and you're trying to lift your heel off of the ground. And then you're gonna relax. I'm gonna move back a little bit, so I don't think you guys can see my foot. So again, you might not be this good the day after surgery, or the day after your injury, but if you keep working on this, it will get better. So squeeze your quadricep, push down into the towel, pull your toes up towards your nose, and try to raise your heel off of the ground or table. Hold that contraction for 5 seconds, and then relax. You're probably wondering, how do I do this? My quad won't go anywhere, there's so much swelling, my thigh looks blah. Keep working at it, and keep telling that brain to make this muscle contract. It will work with increased repetitions. So go ahead, squeeze that quadricep, push down into the towel, pull your toes up towards your nose, and try to raise that heel. And then relax. You're gonna do 10 of these, and you're gonna hold each of them for 5 seconds. Now, if you feel like that's too difficult and you can't get that raise, I'm gonna have you do something with the strap here. We're gonna put it around your foot. You're gonna do everything the same, but you're gonna get a little bit of pull up and back towards your chest. So again, squeeze your quadricep, push down into the towel, pull your toes up towards your nose, and now raise your heel and keep pushing down into this towel. Hold it for 5 seconds and then relax. So this is assisted knee extension and assisted quad set. This is called a quad set, and it's the most important exercise that you can do before you go into surgery, because this quadricep is what's going to help you stand and walk and bend and flex your knee when you get out of surgery. Most important exercise. Once we get that done, we're going to go into what's called a single leg raise. And it's going to be really hard to start to do this. I recommend that you guys lay down when you're doing it, but for this purpose, I am going to be upright. So the single leg raise begins with a quad set. Squeeze the quad, push into the towel, toes come up, raise my heel. Now, my leg is super straight. I am going to keep it super straight, and then I'm going to raise it up to meet my other knee. And then I'm going to go back down. I keep it straight, and then I relax. Okay? I squeeze my quadricep, push down into the towel, pull my toes up towards my nose, raise my heel, hold it, squeeze, 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 and then I raise my leg up to meet my other knee. And then I go back down, but don't lose that quad contraction, and relax. I don't have an injury, but my quadricep is burning already. Again, I want you to be doing your exercises laying down. Squeeze the quadricep, push down into the towel, toes come up, heel raises, and then I'm going to raise equal to my other knee, and then I'm going to go back down. Keep it squeezed until I get down. You're going to do 10 reps. Now, if you can't feel like you can, raise that leg up and your knee's kind of bent, it's not worth you doing this exercise because you're not doing it correctly. You could add a strap and then help your leg with the raise. But the goal has to be that this knee gets straight, okay? You can also have a family member help almost levitate your leg by assisting your heel a little bit, all right? We have just a few more exercises. These really don't have much to do with the knee itself, but what they're gonna do is they're gonna help strengthen your hips and activate the muscles surrounding the knee, and that are gonna help support the knee over time. So we're gonna lay on our side. This is called sideline abduction, and what we're gonna do is roll forward a little bit. I make you do a quad set, okay? So squeeze this quadricep, straighten the knee, toes come up, and then we're gonna roll forward. Our toes are gonna go down, tap behind our other leg, and then we're gonna raise the leg up towards the ceiling. And then we're gonna go down and tap. And then we're gonna raise up and hold. Now you wanna feel this on the back side of your bum. I do not want it in the front, and I don't want you rotating open. We don't need the hip flexors to be strong in this point. We need to get the back side of your glute muscle, which is called your gluteus medius. This is super important when you're going to be post-operative because this muscle is what helps support and stabilize that knee. The reason why I want you rotating down is because we get the posterior fibers of glute med, which also help with more of that hip stability, and they are often underworked, and the TFL and the other hip flexors are the ones that kind of overtake for the glute med. Good, the whole time you're trying to squeeze that quadricep. You'll do 10 of these, and then you'll take a break. Then we're gonna go roll onto our belly, and then we're going to straighten this leg, do that quadricep contraction, your toes come up towards your nose, and then we're gonna try to raise our straight leg up to the ceiling. This is called prone hip extension. and then relax in between. Your toes are down, kick that knee up towards the ceiling, and then raise this leg up. Squeeze through your glute, and then relax. Your toes are kind of tucked underneath because they're already pulled up towards your nose. And then you're gonna go ahead and quad set, meaning I'm gonna straighten my knee. For this instance, it's that my knee is going up towards the ceiling. Once I have that, I'm going to reach my leg up to the ceiling. I really wanna make sure that I'm using my glute and not my hamstring, but do your best. So, with my toes tucked under already, my knee is slightly bent, I'm going to quad set and straighten my knee. I'm going to keep my toes pulling up towards my nose, and I'm going to squeeze my glute and raise my straight leg. Again, you want to avoid doing this, okay? This is not doing anything for your exercises. It's helping your glute, but it isn't really helping the quad set and the knee. Okay. So we have two last exercises. These ones are a little bit more mobile, but they're to help you normalize during your daily activities and just get some more muscle pumping to help move that swelling up and out of your knee. So last two exercises, we're going to do sit to stand. I'll bring this right in front. Ooh, I'll take off my other shoe. All right, so you can do this to an elevated seat, or if you can get down all the way, that's great. But you're going to go ahead, you can reach using your hands and then sit all the way down. That makes your knees bend to at least 90 degrees, and then we're gonna go ahead and stand back up. We'll do that 10 times. Use your hands if you need to. You can shift weight if you need to, but it's okay for right now. It's not gonna look pretty. And we're gonna do 10 of these. You can use your hands to get up. And then by week 2 and 3, hopefully you're able to do little taps or more of a squat. Good. The last exercise are going to be heel raises. So we're gonna come up onto our toes, and then we're gonna come back down. Now, what's important to look at is that we're gonna do that quad set again. We're gonna squeeze those quads back, push the knee back, and then we're gonna come up onto our toes. Good. It's always nice if you're holding on to something. I like to stay up top for 2 to 3 seconds. It gets those quads active a little bit more as well. Squeeze the quads, hold on to something, raise up, and then come on back down. You can do this with the knee immobilizer on if you don't feel comfortable in that surgical or the injured leg, but you don't have to if you're being pretty cautious and you're holding on to something. All right, guys, so those are some of my favorite prehab exercises. Again, they are what you can start the day after you injure your ACL. I know that you probably have a lot of questions regarding this injury, but the sooner that you start moving this knee, the better you are going to feel. By week 4, you should feel almost completely normal to the point where you might not feel like you need surgery. You probably do in order to get back to the activities that you like to do. But between day 1 and week 4, you really should start to be able to do all of your daily activities. You're walking, going up and down the stairs. You're not doing any running or jogging, but you feel like you might be able to, okay? So we want to get as much strength before you get your surgery as possible. So follow along. We've got more prehab exercises for week 2, 3, and 4, and those will progress and get a little bit harder so that you can challenge yourself and get as strong as possible before your surgery. So if you have any questions, drop them in the comment below, and make sure that you subscribe to our YouTube channel because we're going to have so much information about ACL injuries and ACL rehab coming.